So hello everybody, my name is Ebony, like Ryan just said, and I'm in my first year of my master's here at the Health and Rehab Science field, focusing in health promotion. So today I'm going to talk to you about access to health information and a bit about the technology infrastructure in rural Ontario. So I am in health promotion, and the World Health Organization defines health promotion as the process of enabling people to increase control over their health and its determinants, and thereby improving their health. The recent and evolving internet technologies support this health promotion practice because of the availability of online health information. The value of having health information in multiple formats, including text, audio, visual, and in multiple languages, enhances individuals' ability to become informed and keep others informed as well. So here's an example of one of the many studies that support this health promotion theory with online access to health information in the internet. This study was done on a group of HIV patients, and they used the internet to look up and research health-related different things about their disease and what they have, and just sort of different sort of information pieces to go along with that. And it was found that increased their self-efficacy, their coping skills, and social support skills as well. So my point here is to demonstrate the usefulness of online health information and how it supports health promotion. However, not everybody has these kinds of resources available to them. Here's a map of Ontario, and all of the purple dots represent different reserves. There's just less than 300,000 Aboriginal people living in Ontario right now, and just less than half of them live sort of on the top half of Ontario there, so very rural and remote areas. The prevalence of chronic disease and perceived poor quality of life among a lot of these Aboriginal peoples is much less compared to that of the Canadian population. And these particular communities tend to have lower socioeconomical statuses, typified by low levels of education, income, and employment. Highlighted by this is their increasing rates of diabetes, chronic disease, obesity, and so on and so forth. Additionally, the health information technology and connectivity infrastructure in these northern areas is not sufficient, meaning that even if some of these people have a computer, they can't readily access health information online. So I wonder how many people recognize this familiar sound. So that might have seemed like it drowned on and on, but I actually did cut it off. So yes, that is the familiar sound of a dial-up connection. So when I say broadband connectivity here, and the red areas are representing on that reserve that there's more than 800 people without broadband connectivity, the purple areas there are representing 400 to 800 people without broadband connectivity, and the yellow and orange areas, which go a little bit more south, are representing 100 to 200 people on that reserve without broadband connectivity. And what broadband connectivity means to this graph is that they either have no service at all or at maximum a dial-up connection. So we can understand how frustrating that could be if that's how you had to access your health information all the time. So there are some initiatives currently being done with Industry Canada and the Ministry of Agricultural Food and Rural Affairs. The Rural Connections Broadband Program is one of them. So this explores different ways that we can deliver broadband services to these more rural and remote areas. Usually it's by satellite or some kind of wireless technology. However, this can be very expensive and a lot of times even unaffordable for some of the people living there. Another program is the Community Access Program, and this provides Canadians with affordable access in public areas, so in schools, community centers, and sometimes in libraries. So to tie this all back to the purpose of my research, which is to identify the strategies and information technologies such as internet and social media, and how all of these are used to access health information within Indigenous populations. Additionally, I want to sort of discover or identify the barriers and facilitators to online health information for these populations. By identifying that there is a difference in the North in availability of these internet infrastructures, further highlights the health inequalities that exist there and makes it even harder for them. So the idea of this kind of accessibility to the internet to me is interesting, and it allows me, or gives me the opportunity then to explore other ways in which maybe they're receiving their health information. Is it by schools or a local newspaper or some kind of community webpage? Furthermore, I wonder if these areas did have better internet accessibility, if that would improve their overall health status. That concludes my presentation. I don't think I have an ending slide, so thanks everyone for listening.